Hi, my name is Ogundele Victor Adam Larry Fernandez. I am an occupational therapist in Nigeria. Welcome to my YouTube channel. Today I will be talking about impairments encountered by individuals with neurological conditions. There are quite a number of neurological conditions, but the most common neurological conditions among adults in Nigeria are cerebrovascular accident, also known as stroke, traumatic brain injury, and spinal cord injury. This video will be limited to impairments found in stroke survivors in order not to make it too cumbersome. A stroke is a glitch in the central nervous system, and it produces immediate disorganization throughout the already highly individually organized systems. Most frequently encountered impairments include motor impairments, sensory system impairments, cognitive and psychosocial impairments. The motor impairments include the difficulty with balance, difficulty in postural adjustment to gravity, hypotonicity, which could also be said to be flaccidity, or when the muscles of the affected side appear flabby, hypertonicity, when there is increased tension in the muscles of the affected side, and hyperreflexia, increase in reflexes that would otherwise seem normal. So, sensory system impairments could present as tactile sensation disturbances. The individual might have difficulty interpreting hot, cold, pain, pinprick sensations. The individual might also present sometimes with unawareness of body parts in space, which is usually known as lack of proprioception. But in this video, I would be using very simple terms. So I would say unawareness of body parts in space. And some individuals present with inability to identify objects when placed in their hands, which is otherwise known as astereognosis. Now, hemiplegia is the most common presentation of a stroke. This is where the affected side of the body presents with paralysis. In simple terms, it appears limp and is usually accompanied by sensory disturbances, reduced joint stability, and the shoulder joint is the most susceptible to instability, and it mostly suffers subluxation. Now, in rehabilitation, the goal of rehabilitation is to quickly recover the lost functions, be it motor, be it sensory, and sometimes it could be also compensating for lost functions, but mostly we go for remediative recovery processes. That is, we are trying to recover lost motor functions most of the time, and poor or irregular positioning and handling and inactivity between formal sessions creates confusions in motor learning and relearning and reinforces disability. That is, when an individual goes for a formal session with a therapist and he gets back home and he is inactive, it confuses the brain as to how to relearn the activities that it has stopped carrying out. Positioning of an hemiplegic patient could be quite tiring for carers at home, but the most common position you find carers putting hemiplegic individuals is supine lying, and supine lying is quite detrimental to motor relearning processes because the shoulder joint is going to be affected, it's going to be retracted, and all the way down to the knee, the joints are going to be acted on by gravity, which is going to quite most oftentimes lead to spasticity of some parts of the limbs when the recovery process kicks in. So now there are some recommended positioning in bed that I would like to share. The first one is supported supine lying. When an individual with hemiplegia is lying in bed and wants to lie supine, you support the entire hemiplegic side with pillows. That is, there are going to be pillows elevations. You could use pillow, you could use a soft feathered throw pillow, you could use clothes wrapped up, all the way from the shoulder joint to the knee joint on the affected side of the individual, so as not to allow the parts, since the parts have lost their resistance to gravity, the pillow does the resistance for them. Now, another positioning is lying on the affected side. Say for instance, a person has right side hemiplegia and person lies on the right side of the body, which is most often the most recommended positioning in handling hemiplegic individuals, because while lying on the affected side, the unaffected side, the arm on the unaffected side is very, very free and independent, and the patient can reach forward, upward, and backward. Now, lying on the unaffected side also is recommended, but it doesn't come highly recommended, because most times it needs elevations. The unaffected side is on the bed and the affected side is going to need a lot of support. The arm and the legs are going to need, the leg and the arm on the unaffected side, is going to need elevations. You could use a pillow, you could use a clothing material to elevate the arm, just because you want to create a kind of restrictive force or an opposing force to the gravity that is acting on that side of the body. And for positioning while sitting down, most times individuals that have suffered stroke sit down and slouch backwards in their chair like this. This position is quite bad, because it doesn't strengthen the appropriate muscles it's supposed to strengthen. You're supposed to position in an upright sitting position so that gravity acts on the body, and then the side that is actually weak gets supported so that it doesn't fall on its own due to gravity. Another very serious situation in caring for stroke patient is the handling, because most times when carers handle stroke patients or stroke individuals that have suffered stroke, the handling most times pose a lot of problems and threats to the recovery of the patients or the individuals suffering from stroke. The first thing we're going to be talking about in handling is mobility in bed, moving across the bed. The individual wants to get from one end of the bed to the other side of the bed. Most carers in this situation mostly make this mistake of pulling patients on the affected side, because the patient can actively involve himself in the process by raising the unaffected side, but the affected side is usually pulled by most carer. This is a very wrong way of handling a patient that wants to move across the bed, or an individual that wants to move across the bed. The best way to do this is to support, not pull now, support the affected side by placing the hand under the shoulder joint and under the hip, while the patient props himself up and pushes off the bed towards you. In that way it serves more purpose for the person carrying the patient, helping the patient move across the bed, and the patient himself. Now, another thing is when the patient wants to move up in bed. If the patient wants to move up in bed, you could also use the same technique. Put one hand under the shoulder of the person, and one hand under the other hand under the hip of the person on the affected side, and you voice prompt the person to move along with when you are moving. Under no circumstance should the shoulder be pulled apart from the body, as in pulling on the affected arm of the individual with the stroke. Now, turning on the affected side and turning on the affected side and going from lying to sitting. The elbow should be flexed at 90 degrees if the person is going to slightly turn on the affected side. That would put the necessary amount of pressure needed for the tone on the side to get back to what it used to be. And then when the patient is going from lying to sitting, the carer supporting should not pull from the affected side. The person is going to lift off himself with the force that comes from the unaffected hand, and when he pushes off from the bed, the carer supports like this on the unaffected side, while the patient does the active movement on the affected side. Right. Subsequently, more videos would come on proper handling and transfer in bed and out of bed for stroke patients. Thank you for watching. Please don't forget to like this video and also subscribe to this channel to ensure auto notifications of subsequent episodes. Thank you.